Facial Plastics, where art and medicine come face to face.
Hello, my name is Daniel C. Dobby. I'm a board-certified facial plastic and reconstructive surgeon and fellowship trained. I practice here on the Gulf Coast of Florida and have been here for approximately 20 years. Today we're speaking of blepharoplasty, which is the fancy word for eyelid surgery. We perform these here in our office, and sometimes we perform them outside of our office. The vast majority of the time they're done for purely cosmetic reasons, but occasionally we do them for functional reasons, should the eyelids be covering the pupil of the eye or the opening of the eye, or people have difficulty seeing. The surgery is fairly straightforward. It's performed under local anesthetic oftentimes so that the patient's awake and can move and animate while we're doing the surgery. And sometimes we put the patient to sleep while we do this because the patient is anxious or really just wants to be put to sleep while they have this kind of surgery. The surgery itself is usually fairly straightforward. When patients return home, they have some blurring of the vision for the first 24 hours, but after that, the vast majority of the time it clears very quickly. You have stitches in your eyes which remain for 5 to 7 days, but you can usually return to work in 3 to 4. I tell people they really look pretty good at about a week and can cover up any bruising with makeup should it be necessary. It's a relatively painless procedure. Very few patients complain of significant pain. We're able to treat the upper eyelids by themselves or the lower eyelids by themselves. And really the goal of surgery most of the time with both the upper and lower eyelids is to remove the droopiness, the heaviness, or the fullness in the eyelids and make them look more youthful.
Gulf Coast Facial Plastics, 200 Doctors Drive, Panama City, Florida.